My name is Robbie Blaha. I work on the Texas Deaf-Blind Project. I've been on the project since 1982. Prior to that, I was a teacher of deaf-blind and worked with children with deaf-blindness in one of the pilot projects. I was really excited when OSEP asked that there be kind of a gathering of information on interveners, that they wanted to hear what the families said and what project staff said and what administrators in local districts say, that the stakeholders were all pulled together to talk about this. To me is a wonderful thing. People have been working very hard on this for, well, a couple decades or longer. And I think to bring our field together, we need to sit down and do a national comparing of notes on behalf of these children who are the lowest of low incidence disabilities. I know things have happened for children with deaf-blindness in other centuries and other times that have been very important. Certainly in the United States, Helen Keller, and the wonderful things that occurred at Perkins School for the Blind. But in a sense, our field really galvanized, I think, during the 60s with the rubella epidemic that was worldwide. And due to, I think, medical technology interventions, especially in the area of heart surgery, the ability to do heart surgery on very young children, at that time, so many of the children lived and thrived. And no one had ever seen children like this or thought about educating them. This was before IDEA. This is before IEPs. And the parents, it's always the parents who really, I think, can shift things. And they made appeals to Congress, and funds were set aside to help understand how these children learn and what can be done. And so, as a result, regional centers were set up in this country in the 70s. I believe the early 70s is when they came into being. And Texas we were part of a multi-state, there were multi-state regional centers, and we were part of that. And we were with Oklahoma and Louisiana, and the center was actually in Texas, but it was a multi-state. And their job was to gather and disseminate information on deaf-blindness because it just wasn't available. The children were there, the families were there, the information wasn't there. And in a lot of respects, the information really didn't exist in a form that could be shared. It was very much an oral tradition at that point, just the telling of stories or things that they had heard in other countries that worked. And certainly Dr. Jan van Dyke, during that period, his studies of the rubella epidemic worldwide, and some of that information was kind of trickling into the United States. And this pilot programs, the schools that they set up during that time as well for the children, it was paid for by the federal government, and the teachers were paid for. We were paid. We had teachers of deaf-blind. That's what we did. All the students we worked with were children with deaf-blindness, and that's how we perceived ourselves, and that's where our efforts in coursework, getting coursework and intensive intervention, in-service, I mean, that's what we did. A lot of information was gathered during that period, and information was shared internationally, and there began to be really a body of information that talked about how to teach children who have deaf-blindness with the combined effects, that there is something that can be done. And certainly when IDEA came in, the first IDEA, and then, of course, in 2004 as well, deaf-blindness is recognized as a distinct population. It's the lowest of low incidence, so it's rare. And with that comes some complications for districts and families. One thing that helped, again, to offset this situation of being very rare and very complicated was in the 90s, OSEP started a national clearinghouse on deaf-blindness and a national group that kind of helped pull information together at a national level and assist the deaf-blind projects that had come into being during the 80s. So the deaf-blind projects were there, the National Clearinghouse was there, and what was interesting is that we had a lot of information on deaf-blindness at that point that was fairly well packaged. So we had the content. And then we began at that point also to do a census during the 90s. So the states started knowing where the children were, where the families were. So we like knew where the population was. We had the content. We had a technical assistance model, but we didn't have staff who specialized in deaf-blindness.